Today, we're going inside the high-stakes world of the emergency room and the ICU. We're looking at a powerful new tool that's being put in the hands of nurses, Predictive AI. Now, these algorithms are designed to be lifesavers, to spot a crisis before a human even can. But with that kind of power comes a serious ethical test. So, let's get into it.
Think about this for a second. Can an AI save your life? On one hand, absolutely. An early warning from an algorithm could be the one thing that prevents a catastrophic health event. But what happens when that algorithm gets it wrong? I mean, the stakes literally could not be higher. And that tension, right there, is what we're exploring today.
So you might be wondering, why even bring AI into this at all? Well, it all comes down to a really interesting trade-off. On one side, you have human expertise. A great nurse has this nuanced, gut-level understanding that comes from years of experience. But that kind of deep thinking takes time. On the other side, you've got predictive AI. It's lightning fast, and it can sift through mountains of data to find hidden patterns a person might miss. The dream, of course, is to bring those two worlds together.
And that's exactly where systems like the National Early Warning Score, or NEWS, come into play. Picture this. It's like a super smart alarm system for a patient's health. It's constantly pulling in real-time data, vital signs, lab results, you name it, and it crunches it all down into a single risk score. If that number gets too high, bam! An alert goes right to the nurses, giving them a critical head start.
Sounds perfect, right? A total game changer. But, and you knew there was a but, this is where things get really complicated. This incredible power to predict also comes with a whole set of hidden dangers. Dangers that touch on everything from patient privacy to fairness and even the very nature of what it means to be a nurse.
And this is where the research we're looking at today gets really interesting. See, researchers dove deep into all the studies on this topic, and they didn't just find a random list of problems. No, they actually organized the entire ethical landscape into a clear framework, revealing 5 distinct categories of risk that we all need to understand.
So here's the whole shebang, the 5 major dimensions of ethical risk. It covers everything. You've got the data and the algorithm itself. You've got the impact on the nurse's job, patient rights, which is huge, how these systems are governed and potentially misused, and finally, whether people will even accept them. This really gives us the full map of the challenges we're facing.
Okay, so we've seen the big picture. Now, let's zoom in on a couple of the thorniest, most urgent issues that pop out from this framework. We're talking about hidden bias, the blame game, and these mysterious black boxes.
First things first, what do we actually mean by algorithmic bias? Well, it's not just a random glitch. It's a systematic, baked-in flaw. It happens when you train an AI on data that's lopsided or doesn't reflect the real world. The AI learns those skewed patterns and ends up producing unfair, even dangerous results for certain groups of people.
And this isn't just a theory. The research spells it out, warning of, and this is a direct quote, uneven accuracy among minority groups and patients with chronic diseases. What that means in plain English is that these tools could actually make healthcare less fair, widening the health gaps that already exist. This isn't just a coding problem, it's a full-blown ethical crisis.
And that leads to this massive million-dollar question. When a biased algorithm contributes to a mistake, who's on the hook? Is it the nurse who trusted the alert? The hospital that bought the software? The tech company that wrote the code? All of a sudden, you have this huge responsibility gap, leaving everyone in a legal and ethical limbo. Beyond bias and blame, there's this other huge risk. What happens to the nurses themselves? If you rely too much on automation, your own expert judgment can start to get a little rusty. Then you have something called alert fatigue. Imagine your car alarm going off every 5 minutes for no reason. Eventually, you just ignore it, right? The same thing can happen here, causing a nurse to miss a real crisis. And if the AI is a black box, meaning no one really understands why it's making a suggestion, how can you ever fully trust it? Okay, I know that sounds like a lot of problems, but here's the good news. The research doesn't just leave us there. It shifts gears and gives us a concrete blueprint for solutions, a real actionable plan for how to build and manage these AI systems responsibly. The solution is built on 4 pathways that all have to work together. It starts at the ground level with the technology and the data. Then it moves into the clinic, focusing on how humans and machines can best collaborate. From there, it expands to the whole organization, making sure hospitals have the right skills and training. And finally, it looks at the big picture, the policies and regulations we need to keep everyone safe. And you can see right here how this plan works in the real world. This table connects the dots. So if the risk is data privacy, the solution is technical, like using end-to-end encryption.
If the risk is algorithmic bias, you fight it with regular fairness audits. It shows that for every one of these big ethical problems, there's a tangible, achievable solution.
And this really gets to the heart of the matter. The whole point of ethical AI in medicine isn't about replacing human experts. Not at all. It's about giving them a superpower, designing a tool that augments their skills and empowers them to provide even better, safer care.
So this is what the future of healthcare is really about. It's not some battle of humans versus machines. It's a future built on collaboration, where the irreplaceable empathy and deep expertise of a nurse is supercharged by intelligent, fair, and transparent technology. And if you think this is all some far-off futuristic problem, get this. A staggering 91% of the research on this topic was published in just the last 2 years. 91%? This isn't a theoretical debate anymore. These challenges are being tackled right now. The ethical test of AI is already here.
So we're left with this final thought. The goal isn't to create a perfect, flawless AI, because that might never exist. The real goal is better, more equitable patient care. The technology is here, and a framework for using it ethically is taking shape. So the only question that's left is, how do we, all of us, build that future together?